Hi everybody, this is the Planet Earth here. I'm going to tell you about anxiety. So, what actually causes my anxiety? What causes your anxiety? Well, I figured it out. Finally, I've talked to a doctor. I went to his house. I finally talked to an actual psychiatrist and psychologist. What actually triggers anxiety? This is going to be one of those videos where I can almost talk like a doctor, but I'm not talking like a doctor and I don't give medical advice, I give mental advice. Alright, so this is the truth here. This is all what the doctors told me. Okay, humans have evolved. We used to be a very basic species. We used to just hunt, reproduce, feed, sleep. That was it. That's all we did was hunt, feed, sleep. That's all we did. Okay, so over the years, the amygdala in our brain has gotten smaller. So, with that in mind, we're actually suffering a physical disorder. What happens is, and excuse my ADHD, I think I have it based on the way I stutter and the way I say I'm going to end this video, but I continue to record it. I'm not focusing correctly, and I apologize. Plus, it might be the lorazepam, aka Ativan, doing it to me. So, now, the answer. We have anxiety because we are not developed enough and we have not evolved enough to have electronics in our life. We have not evolved enough to have vehicles, guns, and knives. Well, knives, but, the basics. We do not have the capacity in 99.9% of humans to have all these electronic devices, to have the stress of money, to have the stress of getting to where you need to go to on time. Because of that, certain people with a irregular amygdala and a certain fear responses may respond to certain lights. Might cause anxiety. Certain sounds, like gunfire, causes anxiety. Certain explosions, that causes anxiety. Car backfiring, that can cause anxiety. Being with a lot of other people, sometimes the fight or flight response kicks in abnormally when you're around a lot of people. This is where social anxiety disorder is. I talked to this doctor for 4 hours. The social anxiety kicks in because when you're around a lot of people, the fight or flight response kicks in and causes you to panic for no reason internally. Even if you're not doing it externally, internally your body's saying, me, people around me, me, all the sirens are going off. That's the reason why we're suffering from anxiety. Now, anxiety attacks are because of a buildup of adrenaline over time. It could be abnormal. It could be a tumor on the adrenal gland itself. It could be a heart disease, which is rare. Heart disease does not usually cause anxiety, but it causes a very rapid heart rate, which can trigger a fatal heart rate and a fatal heart rhythm. Anxiety itself won't do that by itself, but if you're in a highly stressful life or death situation, you most likely will experience palpitations. That happens with people, no matter who you are, no matter how strong you are. You'll get palpitations during a life-threatening event. But also your blood pressure will rise and your other system organs will shut down, some of them, when you're in an actual flight or fight response. That is normal. What's not normal is having that same kind of feeling when you're just sitting down doing nothing. The amygdala is misfiring, and or you have a tumor on your adrenal gland, which is benign. Or the adrenal gland disorder. You could have an adrenal gland disorder. There is another reason why. Low potassium, low calcium, low thyroid problem is a huge motherfucking factor for anxiety. Also, the other reason why we're suffering from anxiety is because we cannot cope with the society that we live in. Whether it be nice or dangerous, we cannot cope. We will never be able to cope until the human race is completely evolved into the electronic stage. Electronics, gas, electricity, etc. So anxiety is not curable. There cannot be a cure, because if they cured anxiety, then you wouldn't have any adrenaline to, such as, like taking beta blockers. It blocks the adrenaline. However, in a lot of people that have normal heart rhythms, they can't take those medications like atenolol, the beta blockers, because it slows their heart rate too much. And it goes dangerously low. It won't stop, but it goes dangerously low. It might palpitates and skips probably. The main one is there's no cure. There can't be a cure. There is no cure for it. You cannot stop your adrenal glands from having the anxiety, which causes the rest of your brain to misfire. However, as you get older, the amygdala slows down. That doesn't mean anything bad, but the amygdala slows down as you get older. So when the amygdala slows down, you become less anxious over time. It won't get worse. It gets better over the years because your amygdala slows down, and the doctor said it slightly repairs itself over many, many years. Because your body is taking it as a constant stressor. It's continuous stressing. So a constant adrenaline is released through your system, which is causing my anxiety, which always causes my anxiety. It causes me to overthink. It causes me to overstress about things. I don't stress over the little things like a remote being out of place, or I do stress out over keys missing. That actually makes me anxious as hell for some reason. I mean, if I lose my keys, I go crazy. I'm looking from tearing up the room. I'm throwing everything across the room to look for those keys. Most people would just be like, I'll find them. Give me a minute. But I get freaking terrible with that. I will look for that key until I find it. I don't care how many hours it takes. If I lose an SD micro card, I will literally look through every single area in my room to find that card. I'll be right back. So the amygdala causes anxiety. There's not a lot you can do to fix it. The benzodiazepines go past the brain-blood barrier. So once they pass the brain-blood barrier, it gets you to the brain, and it calms the amygdala down from misfiring. The amygdala is calmed down and stops the anxiety, temporarily, of course. The chemicals that are in the lorazepam and the benzos, they attack the amygdala and calm it down. It calms the fear. It calms the anxiety. It's the only thing that works. The doctor said, if you want to get technical, the only thing that works without making you too happy are benzodiazepines. He said that's pretty much the only thing that can help with anxiety. Anxiety is a physical problem, but we characterize it as a mental problem. But it is a physical problem, obviously, because people do have panic attacks. So what the hell do we do? He said, the thing is not to have triggers. If you're bothered by the light, turn it off. If you're bothered by the people, stay away. Take the medication way before you go out into public. He said take it an hour before you go out into public. If you have Xanax, wait 30 minutes. If you have lorazepam, wait 45 minutes. If you have Klonopin, wait an hour and 20 minutes. If you have beta blockers, wait about 45 minutes, he said. But beta blockers, they don't really help because they don't calm the amygdala. They only calm the adrenaline. So you're going to still have anxiety, but you won't really feel the heart racing. But you'll still have anxiety. He said benzos, they attack the amygdala, they pass the brain-blood barrier, and it just stops that anxiety in its track. It stops it, actually stops it. It'll force the amygdala just to revert back to its normal self for a temporary time period, like the medication benzos. He said benzos and opiates are the only ones that calm people down. He says, I don't know of any other meds besides antipsychotic medication that will knock people out, but it won't help them with their anxiety. I finally had a doctor that says the truth. He said, antipsychotics are only for people who have psychosis. We give them to people who don't have psychosis, and they end up becoming psychotic. Same thing applies, guys. The same thing applies to antidepressants. If you take antidepressants, but you are not depressed, you shouldn't be taking them. They are going to make you overly manic. That comes with suicidal ideation. This is what they won't tell you. If you're not depressed and you take the antidepressant medications, you can become suicidal and have the urge to hurt yourself. It's weird, but that's the truth. Very strange. If you're depressed, seriously depressed, we're talking, you don't want to leave your house. You don't even want to turn the TV on. You don't even want anybody to talk to you. Then antidepressant medication may work for you. A little bit. But it takes very, very long time. Also, antipsychotic medication is only supposed to be prescribed for either schizophrenia, psychosis, psychotic thinking, and that's it. That's all supposed to be for. If you have anxiety but you don't have depression, they want it. Diet helps because certain food aggravates the amygdala more, causes anxiety. Caffeine causes anxiety because it activates the amygdala and overstimulates it. It also overstimulates the adrenal glands and overstimulates your thyroid. That's a 3-punch into your face. Although I drink caffeine, I don't usually have panic attacks when I drink caffeine. It's when I don't drink caffeine is when I have anxiety. I'm addicted to the stuff. My doctor said you're going to have a very hard time getting off benzos when you want to, because you said you're also addicted to caffeine. I said, yeah, when I don't take caffeine, I am drowsy. He said, well, the only way to do that is you're going to have to get off the caffeine first, then try to get off the benzos, and you won't feel such a bad withdrawal. He said that. Guys, this is a serious issue. This needs to be taken to the max of seriousness. Taking benzos, yes, they're addictive. He knows that, I know that, we know that. We already know this. We already know that we pop those pills. But it works. That's the only thing that stops the amygdala from going crazy, which sends the adrenaline gland off and all those other ones, and all of a sudden you're just going crazy. Antidepressants, serotonin syndrome, anti-anxiety medication is just anti-anxiety. What it really does is it numbs the amygdala, and it numbs part of your brain. The part of the brain that's numbed, you can't have anxiety when you're on that medication. You can't. Even if you're in a dire situation when you're on benzos, the world could be ending. There could be a comet coming to the earth. You may cry, but you won't panic. You can take, let's say you take 1 milligram of Xanax before the comet comes. You would just be like, I want to record this and put it on YouTube. Oh, wait, I can't. Oh, well. Come and get me, bitch. No anxiety medication. I can't believe I can't believe it. I'm gonna. You're gonna panic like a motherfucker, and your heart's gonna be racing extremely fast. You might even die before the thing hits. That is how much you're scared. Now, you take the benzos, you'd be like, oh, it's such a beautiful sky. Look how it's lighting up like that. Yeah, I can't believe I'm gonna end right now. The whole human race is about to end, but that's okay. I'm serious. It numbs your amygdala like that. It numbs your brain like that. Especially if you're high on it. You're taking too much. That's what you mean. You're overdosing on benzodiazepines. It's very hard to kill yourself with overdosing, which is a great thing about benzodiazepines. There's other medications out there that are more dangerous. However, they are addictive. Unfortunately, that's the only downside to benzos, is that they're addictive, and over time they cause you to lose a little bit of IQ, and they cause you to have a little bit of short-term memory loss, which comes back after a couple years. It depends on you, though, and how much you're taking, and what you're taking, and how it affects your body. But other than that, benzos are the cure. He said, look, I don't like prescribing the benzos, but I do it to anybody who has anxiety. And I can tell if they're having anxiety. I test their palms. I test their hands. I test their If they're having an anxiety attack in my office, I will test them. I'll test their heart rate. I'll test their blood pressure. I'll have an EKG done. I will test all that before I even give it to them. Now it says if they're having a major panic attack or anxiety attack in a hospital, I will request that they take an Ativan injection or a Xanax injection or a Klonopin by oral or by intramuscular. He says, I depend on benzos too much, he said, but they work. And he says people live normal, happy lives on benzodiazepines. Same thing for people with neurological disorders. They usually use benzos to calm down the brain. And if your brain is calm, how are you going to twitch? For seizures, benzos certain benzos like Valium can stop seizures. That's what he told me. They can stop certain types of seizures. So that's a good thing. It calms the brain down. Calms that overactive, whatever it may be, if it's the amygdala or if it's just the adrenal gland or if there's a tumor on the adrenal gland or if it's the overactive or underactive thyroid. That's the main cause of anxiety besides low potassium and calcium or lower magnesium. Your vitamin D level can be low and you will have anxiety, but you're going to have other physical problems if you let it be low for too long. So guys, I have been trying to find the answer, and I found the answer, and that's the answer. Unfortunately, there's nothing I can do but take benzodiazepines and try to cope. There is no cure at this time. There is no cure without... Technically, he said there is a cure, but we would have to permanently... something with the amygdala, something with the brain. He said it would pretty much be a lobotomy. That's the cure, he said. There is no cure. Only with time... the anxiety will get less and less. It's very rare that it'll continue to be as strong as it was when you're in your teens and young adult stages. He said after 30 years old, the anxiety attacks won't be as severe. It depends on the person, though. He said most people won't have as many anxiety attacks as if you were 18 years old. He says the first one's always a bad one. And then it gets worse, and then it gets better, depending on your situation. He says it depends on your family violence, your history of family violence. And it depends if you were raped, if you were sexually abused. It depends on all of that. That stuff actually comes back to haunt you later in life. He says if somebody's having a problem, they need to report it. Even if they become into a foster care setting, they will find better parents. At least 70% of the time, he said. He said, get them out of the situation. If you're young and you're having anxiety or starting to, he said, get them out of the situation. They may not develop anxiety. So I asked him another question. How to stop a panic attack? He said, there is no way to stop a panic attack. It's just your body overloaded with adrenaline and cortisol, the stress hormone, and adrenaline. So that's a combination of high blood pressure and a high heart rate. So now that I know, I can tell the difference between something really bad and just an anxiety attack. It's still scary as hell, and I will still be pissed off when having one and crying because they're scary and it feels like you're dying. So other than that, that is how you cope. I tried to find an answer for the cure. There is no cure. He says high levels of vitamin D naturally. He said only naturally. He said you have to get the sunlight. He says taking the vitamin D is not going to work. Unless you have low vitamin D, he says, then take the vitamin D. But he said just get out in the sun. If you live in the northern hemisphere, take as much vitamin D as you can. He says you can take 10, 20,000 IUs every few days. You'll be fine. He says you can't. He says you would have to take about a whole 18-wheeler full size of vitamin D, 10,000 IU units continuously to overdose on vitamin D. But he said don't take too much. He said just take like 10,000 every few days. Make sure your level's in the 30s to 40s. He says the 40 is the optimal range in the United States system. Whatever the hell it is, 30 to 40 is the optimal range that he recommends. That helps anxiety. He says magnesium helps anxiety. It depends on the person. Most people have reactions to magnesium if it's not natural. Even if it's in a pill form and say natural, it's not natural. It's still chemically induced magnesium. He says you have to get magnesium from the proper fruits and vegetables that produce magnesium or whatever you get it from. Meat, whatever. He says you have to get the natural potassium and magnesium. excuse me for my ADHD. I'm trying my best to fight stuttering and saying, I do have ADHD. I do. Plus my Ativan makes me slur a little bit. But it's not a stroke. But other than that, that's how you cope with anxiety. If you have a doctor and he doesn't want to willing to prescribe those benzos, or if you have a nurse or whatever you have that won't prescribe them, go to another one. And you keep going till you find one that will give one to you. And the doctor said, try not to take too much, but you build up a tolerance. The brain is like, it feels so good, I want more, I want more. It's like in a drug, like illegal drugs, but it's legal, it's completely legal. But it's a controlled substance. It's kind of hard to possess because of the fact that it actually works on you. I guess they don't want you to have... The benzos in patients should be lowered to a class to where people can get it over the counter. In a way, it should be like that. Unfortunately, it's not. But anyways, I just wanted to give you that video. This is the cleanest, except for the one cussing thing, but this is the cleanest video I can give out to you guys about the anxiety disorders and what I found out about it. Thank you guys for watching. This has been The Planet Earth here.